For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Today, we'll be discussing the spread of Omicron variant here in Santa Clara County. Today, we have Dr. Sarah Cody, Health Officer and Director of Public Health in the County of Santa Clara. And we also have Dr. Marty Fensterscheif, COVID-19 Vaccine Officer here in Santa Clara County. We will begin this press conference in English. We will then move and allow time for questions. And then we will be transitioning into Spanish, Chinese, Vietnamese, and Tagalog from the podium. All right, without any further ado, I welcome to the podium Dr. Sarah Cody.
Thank you. So good morning, everyone. Today I wanted to provide an update on Omicron here in Santa Clara County as promised when we came before you last week, as well as a sense for what we see in our near future and what each of us need to do to be best prepared. So as of this morning, we have 10 confirmed cases of Omicron reported to us here in Santa Clara County. I want to tell you just a little bit more about those 10 cases. 4 were unvaccinated, 5 were vaccinated but not yet boosted, and 1 was boosted but just boosted, not within the 2 weeks of their exposure. They had a combination. A handful had international travel, a handful had domestic travel, and a handful were household contacts. Most were symptomatic. None required hospitalization, or at least have not required hospitalization to date. We also now have had Omicron detections in all 4 of the sewer sheds that we monitor. Last week, I shared with you that we'd had a detection in the sewer shed that corresponds to the northern part of the county. Now, each of the 4 sewer sheds have had detection. So that covers most of the population of the county with a detection in each sewer shed. So I want to talk a little bit about what this means, what we're learning internationally and across the country, and how we sort of square that up with what we're seeing here and what we do next. So when I look around the corner ahead, what I see is a deluge of Omicron. What I see is perhaps one of the most challenging moments that we've had yet in the pandemic. And I think it's challenging because it's not what we're expecting. We've all come to learn to live with COVID over the last 2 years, and we're all a bit tired. But I want to let you know that when I look around the corner, I see a lot of COVID and a lot of Omicron. And why do I say this? I think it's because right now, Omicron is really taking hold across Europe, and I believe it will do the same here in the United States. Just as at the beginning of the pandemic, we looked to the experience in Italy to help us predict what will happen here, we now look to what's happening in other highly vaccinated communities. Norway and Denmark, for example, are highly vaccinated, just as we are here in Santa Clara County, and they've both seen explosive growth of Omicron. Right now in the United Kingdom, and particularly in London, I believe they're seeing more cases than they have at any time yet during the pandemic. And indeed, here in the United States, more states than not have reported Omicron. And in some parts of the country, Omicron is beginning to take off. So how do we make sense of this? And what do we each need to do? Well, first of all, I really cannot underscore enough the critical importance of booster shots. This is particularly important for people who are at increased risk of landing in the hospital or dying of COVID. So the older you get, the more your risk increases and the more urgent it is for you to get a booster shot. But we recommend booster shots for everybody who is eligible. So some people may be thinking, okay, if this Omicron variant spreads so quickly, and if so many people who get it are vaccinated, what now? I think what's really, really, really important to understand is that it's the booster that increases your protection again and makes it much safer for you, much less likely to go to the hospital, much less likely to die, and much less likely that you're going to spread infection to someone who is at greater risk. So, in addition to boosting, I also want to say, as I always say, that this is about layers of prevention. No single strategy works. We have to combine them. And so in addition to vaccination and boosting, it's so important to mask, particularly indoors. I'm masking outdoors today because we're here kind of closely together. So if you're outdoors in a crowded setting, you also want to mask. And testing. Test before you go. Test before a gathering. Get that quick rapid test before you gather with others. Just gather with people who are vaccinated and boosted. Think about ventilation and think about the size of the gathering. So I just wanted to make sure that everyone in our community understands what's ahead and what's around the corner, because there are things that we can do now to make the winter a little less difficult for all of us. Now I'm going to turn it over to Dr. Fensterscheib to talk a little bit more about where we are with vaccinations and boosters.
Thank you, Dr. Cody. Good afternoon. Just want to report that actually, as far as our levels of vaccinations in our county, we're doing very, very well. First of all, on the primary vaccine series, those first 2 shots, we are announcing that we have reached 80% of the entire community is vaccinated, completely vaccinated. So of everybody, even those that are not eligible yet, if you look at the numbers, 80% of everybody in our community has completed a vaccine primary series. The 5 to 11-year-olds, again, that have been most recently eligible, we are at 43% that have received at least 1 dose of vaccine. Now we move on to boosters. Not doing as well. We are at a total of 44% of people 18 years of age and older who have received a booster. 44%. We did not include the 16 and 17-year-olds who have been recently eligible because, again, they are just now getting started. I do want to point out, though, that, as Dr. Cody mentioned, those who are 50 years and older are at highest risk, and that is the population we absolutely want to make sure have gotten their booster or are planning to get one. But the numbers show that 65 and older, only about 64% have received that are eligible, and 50 to 64, about half of them. When you look at the actual numbers, what does that translate to people? If you look at the 50 to 64, 50 years and older rather, it's a total of 250,000 people. 250,000 people in our community, they are 50 years or older, have not yet gotten their booster doses. So again, we want to emphasize that. Also, there continues to be some disparities when we look at our numbers for boosters, that our white population and our Asian population is outpacing our Latino and African American population. The Asian and white population vary from 48 to 53% boosted, those that are eligible, and African American Hispanic 33 to 37%. So we have much work to be done in reaching out to the communities in Santa Clara County, especially in the Latino and African American communities. Again, as Dr. Cody said, I just want to emphasize that none of our prevention tools replace any others. And so vaccinations are our most important, and our boosters are our most important. But again, there's still the need to use all of the tools in our toolbox: the mask, the testing, the social distancing, the ventilation, so that we're using all the tools in our Keep Safe toolbox to keep us safe. And with that, I'll turn it back over to Roger.
All right, everyone, we'll now move to the question and answer portion. Please identify who you are with and who your question is for so the right person comes up. We're going to start over here at the right with Mercury News.
Dr. Cody, two questions if I may. So the first one is you mentioned that Omicron has now been detected in 4 parts of the county watersheds, whereas a week ago it was in 1. What does this indicate at a county-wide level? Does it mean that now Omicron is here and in a week or 2 we're going to see a lot more cases? Or what does it mean that now 4 watersheds have it? And then my second question for you is, so 12 to 15-year-olds can't be boosted at the moment, and some of them are 6 months out of their last vaccine. Would you recommend a change in policy to make this age group eligible for boosters?
So let me start with your first question, which is what does it mean that we've had a detection in each of the 4 sewer sheds? What this means is that we know from our case reports that Omicron is present in the community, and now we know from our sewer sheds that it's not only present, but it's present at some level in all parts of the county. We don't know at what level, right? We've only had 10 cases reported, which doesn't seem like a lot. But the reason why I mentioned that in conjunction with the experience in Europe and other parts of the world is to say that the growth can be explosive. So when you look at the cases, the curve, rather than sort of trending up, it tends to go up a bit more vertically. So having identified 10 reported cases now and having identified it in the sewer shed, and looking at experiences at other places, when you put that all together, you can project that we may have a lot of Omicron very soon. I also want to say right now what we have is Delta. Our case rates are sort of bouncing around a little bit, but at the moment the case rates are somewhat stable, all Delta. Hospitalizations somewhat stable, presumably all Delta. But what we think is going to happen is a big Omicron wave surge on top of Delta. That's what that's about. And as to your questions around the 14 to 15-year-olds, I think I'm actually going to invite Dr. Fensterscheib to field that question.
So most recently, the 16 to 17-year-olds have become eligible for a booster. And as you mentioned, there are some younger teenagers that are now coming to 6 tons. We suspect that the FDA and the CDC will shortly add those additional 15 to 16-year-olds and probably even from 12 up to 15 to the eligibility list. It hasn't happened yet, but we suspect it as more and more get to the point where they're 6 months out from their primary dose.
NBC? And for who?
For Dr. Cody. Dr. Cody, you talked about this being one of the most challenging points of the pandemic. Are there any talks or do you anticipate any plans to bring back restrictions or perhaps put out restrictions that are more strict than what the state would offer?
So the question is, given that this is an extraordinarily difficult moment in the pandemic, what are the plans? And what I would say is that one is, what makes this so difficult? I think what makes this so difficult is, one, we now have a variant that all evidence suggests grows really fast and takes over really fast. And it's happening in a setting where, one, we're all anticipating, gosh, can't we please relax for the winter holidays? 2, we've been at this for 2 years. We're awfully tired. Please don't tell us to do anything else, right? That is how we all feel. So that combination is really challenging. As far as what we do, I would say that we have 2 years of experience. We have, as Dr. Fensterscheib said, tools that we know work. They have to be used in combination, right? I trust our community. People know what to do, right? So just being vaccinated or just being boosted, probably not enough. you need to also mask. You need to, if you're gathering inside where people are going to take their mask off, like a holiday gathering, best recommendation is get everyone quickly tested before coming together to make sure that someone is not infectious and doesn't know it. So what we are going to strongly recommend and model as much as we can is adding those layers of prevention in order to protect our healthcare delivery system this winter.
ABC?
Yeah, you just kind of mentioned, Dr. Cody, the frustration that people are having, even you yourself are having. What do you tell to those people that are frustrated that we are still going through this, and now that you're saying it could be even worse here coming up?
What I would say is, one, we have all been living with this pandemic for 2 years. Everyone has experienced, a lot of change, a lot of uncertainty, and in many cases, a lot of difficulty. That is the reality that we have. However, we can't simply, lay down or put our head in the sand. And I feel that it is critically important to share with the public what we're seeing, because this is what we think about every day. And when I look around the corner, what I see is a whole lot of Omicron, and it could, be coming up on us. So I think it's simply a just recognizing this is where we are, and each of us, as always, has to do our best.
KTVU?
Good question, Doctor. You said we were at 80% vaccination for everyone. I remember a year ago, maybe it looked like a lot of talk about herd immunity and it being at the approximate 80% mark. 80%, 4 out of 5 people vaccinated, still we have the virus continuing to spread. Do the vaccinations actually are ineffective in stopping it? Or is the vaccination just designed to make sure that the hospital system is not overwhelmed? And the follow-up is, if you have a lot more Omicron, use your word, Omicron, are you worried that the system could be swamped? Because even though it's not as severe, you have so many more cases, maybe you could swamp the system, the hospital.
What I want to emphasize is that the situation on the ground with the pandemic has changed over time, right? Every few months there's something different. It's a different variant that behaves a different way. We have a new vaccine to offer and we need to see how it works, et cetera, et cetera. So as the pandemic changes, so too does our response need to change. What we have before us now is the reality that with 2 doses of an mRNA vaccine or 1 doses of J&J, we know that protection fades over time. So everybody who's eligible needs a booster to raise their protection level back up to where it was, right? We want to keep our immunity levels high for what we're likely to be exposed to. So that's the importance of boosters. As to the goals now are, we want to, we hold a couple goals together. So one very important goal is we've got to keep our healthcare system highly functional with room for anyone who needs care for whatever that is. So we do not want to overwhelm the healthcare system with COVID. We want to prevent doing that. And we also want to do everything that we can to allow people to continue to live their lives with adaptations for COVID, but not overwhelm. And that's why boost.
Are you concerned, though, that this deluge will overwhelm the system? And if that does happen, should we look at the possibility of going back into lockdown?
Right now, what we're doing is looking at models and trying to understand all the different things that we can do to prevent a deluge. And so those important things that we can all do to prevent a deluge are getting boosted. And it's particularly important for people who are at highest risk of hospitalization to get their booster as quickly as they can.
KPIX.
So given what you're saying about the booster today and what you guys have both said in the past, I'm curious to this. Should we redefine fully vaccinated as the getting that booster shot once you become eligible?
What we're saying is that the initial vaccine series that 80% of our population have gotten isn't enough anymore because the situation on the ground has changed. And so to be fully up to date with COVID vaccine protection, you need to have a booster.
But would it help to kind of have that language and guidance from city and state leaders?
Well, I can't speak to what the federal and state will do as far as definition, but what I can tell you is that the way to think about it is that the initial series that 80% of us got needs a boost to give us that full up-to-date protection that we need.
Mercury News.
Yeah, so we were talking about that 12 to 15 years of age group who aren't eligible for the booster. You were saying that it's likely that the federal government will approve that, or you expect it. But my question is, do you recommend that? Would you support that happening, that age group being eligible for a booster? And then a follow-up is that there's an increasing number of studies that are showing a decrease in vaccination effectiveness after 4 months. But the CDC says we must wait to get boosted after 6. Given the arrival of Omicron, would you support a change in policy to narrow the time before booster?
I would say that in our county, we follow the federal guidelines as a rule. And I will invite Dr. Fensterscheib if he has any further thoughts on your specific questions.
Again, in order to make those determinations, you really need a lot of science behind it. And so we really look to the CDC and to even the WHO to take all of the data. But clearly, we would support as additional eligibilities come on board for lowering those booster ages. I think we definitely would support it. But as I gave you the numbers already of the people at highest risk, and again, those that are 50 years and older, 250,000 people have still not gotten their booster. So before we worry about going younger, let's get those 250,000 adults boosted so that we can keep them from getting hospitalized or dying.
NBC.
Dr. Cody, with this rise in cases, is the county planning on making the move like San Francisco or Contra Costa County and requiring vaccinations to go inside certain businesses?
So the question is, are we going to change policy as far as vaccination requirements? In Santa Clara County, as we said, we have extraordinarily high vaccination rates. And yesterday we did reach that milestone of 80% of the population vaccinated with the primary series. But what we now know is so important is the booster. And so we've not made any little small mandates or changes around who can do what in what setting. Rather, we're really focusing an all-out effort to let the public know how important it is to get a booster, and that it's particularly important because we have Omicron on the horizon.
ABC.
For Dr. Fensterscheib, what do you guys consider trying to put together some more information about how well these boosters really work against Omicron? What are you guys learning at this point? Is that still something that's really, I know you guys are pushing it obviously, but what have you learned as far as the effectiveness?
Yeah, we're paying attention to to Dr. Fauci and to the WHO and to the CDC, but clearly we've seen already when they put up the antibodies that are produced for somebody that's only had 2 shots, especially looking at Pfizer, that the effectiveness against Omicron was at about 30%. When you boosted that person, the effectiveness went up to 75% at least. So that's some preliminary data, very clear data that, again, the vaccines work. It's just that we need to boost them so that we have more of it on board to protect ourselves.
We'll do final question from KPIX.
So just to pick up on the vaccination rate, do you find that the Do you find that that is still competitive in the Bay Area where you get really high vaccine rates for so long? Is that still competitive with Omicron, or is that no longer the case?
So again, we still have Delta around. So we really worked very hard as a community to get where we are today. And again, it's still our dominant variant, but we're preparing people to say no longer good enough. So if you want to plan for the near future, and as Dr. Cody said, we're worried about this happening in the next several weeks to months, get the booster at this point. But we are one of the highest vaccinated areas, I'd say, in the country at this point.
Thank you, everyone. We'll now move to the portion of our program in Spanish.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.